So the early warning signs of heart failure can actually vary from person to person, but commonly symptoms to watch out for include shortness of breath, particularly on exertion, fatigue and reduced exercise tolerance, swelling, sometimes called edema, particularly in the legs, ankles, or sometimes in the abdomen, a rapid or irregular heartbeat, sometimes referred to as palpitations. Some patients have a persistent cough or wheeze that is productive of white or pink tinged sputum. Weight gain over a few days or weeks is also a hallmark of fluid retention. Early detection and management can significantly improve outcomes, and knowing and looking out for these symptoms and signs is important. So heart failure is a complex condition, and whether it can be reversed or cured depends on its underlying cause and severity. In most cases, heart failure is actually a chronic condition that requires ongoing lifelong management. However, there are situations where it can be significantly improved or even reversed, for example, in treating blood pressure or abnormal heart rhythms effectively. Contemporary heart failure management is very advanced and can lead to excellent outcomes, allowing patients to live well with heart failure. Managing heart failure effectively often involves making several key lifestyle changes that support heart health and improve quality of life. So examples of these may include a healthy diet, reducing salt intake, which will reduce fluid retention and lower blood pressure, eating a diet rich in fresh fruit, vegetables, whole grains, lean proteins, and healthy fats, and avoiding ultra-processed foods, limiting also saturation fats that are saturated with trans fats and cholesterol are helpful. Secondly, regular physical activity. Recent guidance has recommended at least 115 minutes a week of moderate aerobic level exercise, or 75 minutes or more vigorous exercise is useful, and to look to combine this with strengthening and resistance training. Moderate level of exercise is good for you and your heart. Weight management is important. Maintaining a healthy weight with benefits, even a small reduction in weight leads to small benefit in management of not only of your heart but of your greater health. Do not smoke and limit the amount of alcohol you consume. Try to manage stress in ways that work for you and undertake activities that you enjoy. Adhering to medication is really important, and highlight any of the side effect issues that you may have to your healthcare provider. By incorporating these lifestyle changes, you can better manage heart failure, reduce symptoms, and improve your overall health and quality of life. So heart failure isn't a single condition, but rather a spectrum of progressively worsening heart function, from preserved, for example, to reduced ejection fractions. But it can also be categorized into stages, which are better understood as functional classes rather than distinct, easily defined stages. The New York Heart Association classification is probably the most commonly used and one that focuses on everyday activities. So class 1 indicates that patients have no limitation of physical activity. They can carry on with their normal activities of daily living. Class 2 highlights slight limitations of physical activity, symptoms like fatigue, palpitations, or shortness of breath on ordinary physical activities. Patients are comfortable at rest, but symptoms when, for example, climbing stairs. Class 3 is marked limitations of physical activity. These symptoms occur with less than ordinary physical activity, such as toweling yourself out of the shower. And patients may experience significant fatigue and recovery in their breath as well at rest. Class 4, the final classification, is the inability to carry out physical activity without discomfort, and often highlights symptoms are present at rest. So heart failure is often suspected based on patient symptoms and exam findings. This often leads to further tests, including a simple blood test called NT-proBNP, which is a small molecule that's released by the heart under stress or stretch. Often recording of the heart rhythm, called an ECG, is undertaken, and sometimes a chest X-ray is performed. If any of these tests are abnormal, a patient is then referred to undergo often an ultrasound scan of the heart called an echocardiogram. This allows us to confirm the diagnosis of heart failure, but not always identify the cause, which may need then further investigations. Ongoing monitoring of patients with heart failure is crucial to allow adjustment of treatments and to manage recurrent or developing symptoms effectively. Depending on the severity and response to treatment, patients can be managed both in primary care or in specialist clinics. Broadly speaking, the following can be very effective: regular follow-ups with a healthcare provider, repeat investigations over time, such as an echocardiogram and NT-proBNP, can show improvement or progression of disease. Self-management is really important, such as surveillance of symptoms, monitoring of your weight and blood pressures. More specific monitoring using implantable cardiac devices can also be utilized if you have a pacing device implanted. The specific tests and monitoring methods used will depend on the individual patient's needs and the type of heart failure they have. Close collaboration between the patient, the healthcare team, and the specialist physician is crucial for the optimal management of heart failure and ultimately the maintenance of quality of life.